Good morning, everyone. My name is Sarah Thomas, and I'll be your moderator for this concurrent session. One of my roles at BC Renal is to support the Provincial Palliative Care Committee. Our group felt it was very timely and imperative to discuss moral distress as a topic at BC Kidney Days, knowing that the current pandemic has created unprecedented challenges for our renal healthcare professionals. It gives me great pleasure to introduce our guest speaker, Dr. Bashir Jiwani, who will be addressing resiliency and moral distress and how we can keep it together when the pandemic pulls us apart. His bio is very humble and does not speak to the magnitude of his amazing work. Bashir is an ethicist and leads ethics and diversity services at Fraser Health. He has been one of the leading proponents of that program for several years. He is keenly interested in serving the various communities he belongs to live better, more peacefully. Bashir believes this can happen through careful attention to the choices we make and how we choose to be with ourselves and each other. I have no doubt that Dr. Jiwani's thought-provoking topic on moral distress will get you involved in fruitful discussions around the importance of this ethical concept. Please note there is a question and answer tab. Feel free to send your questions along. And without further ado, please welcome Dr. Bashir Jiwani.
Thank you very much for that, Sarah. And I'm delighted to get to be with you all today and spend a few minutes talking about this really important topic. So my hope in the time that we have is to explore this idea of moral distress a little bit more, to try to understand a bit better what it is, how we can kind of deal with it in the moment, and also build our capacity for, in general, preparing for, maybe preventing, and in general, responding to situations of moral distress when we experience them. Particularly, I'm going to start with a little bit of a story about stories. I'm going to talk about why stories are important in our lives. Then we'll do a bit of a case study where I'll talk about Sarah and Mr. Wilson. And then I'll talk about the idea of moral distress, and I'll connect the idea of moral distress with this idea of integrity. And then, as I mentioned, we'll talk about how to deal with those compromises to our integrity that moral distress represent, both in the moment and then from a broader capacity building perspective. But I'd like to start by exploring the idea of stories and how we experience the world. So the question I have for you is, how do you experience the world? We tend to think of ourselves, and we are reasoning creatures, thinking creatures. And sometimes we get preoccupied with what's going on in our minds. But I actually want to suggest that we first experience the world viscerally, in a bodily kind of way. And it's only after that that we start to make meaning of our experiences and clothe them in words. We start to tell stories about what our lives are, what's happening in our lives. And in a way I found useful to kind of illustrate this is to think about, well, painful experiences, frankly. Think about the last time you went to the doctor because you were really hurting. And so the story that comes to my mind is when I had a really bad stomachache. And I'm blessed because my wife is a family physician. And so the doctor I went to was her. And I was hurting and she wanted to help. And so I was, curled up and had my hand on my stomach and I was, oh, this is awful. And so she wanted to help. So she came and asked me questions. She said, tell me, where is the pain? And how bad is it? Scale of 0 to 10. Is it a 5? What number would you give it? And how would you describe it? Is it acute pain? Is it like a dull ache? What kind of pain is it? And she's asking me, she's talking to me, she's giving me throwing these words at me, and I'm just experiencing pain. And I'm like, I don't know, can't you just do something? And so then I realized, of course, that, well, no, in order for me to get better, I need her help. So I need to answer her questions so she can actually help me deal with this experience, this painful experience I'm having. So I say, okay, well, the pain's here and here. No, it's over here. Yeah, no, I think it's only a 5. Oh, no, it's definitely an 8. And it kind of feels like, I don't know, it's sharp. And I'm starting now to put words to this experience I'm having of discomfort as it happens. And so this illustrates, I hope, the fact that, you know, we start to rationalize the experience after we actually go through the experience. So what I'm proposing is that we are all composing the story, the written or the in language story of our lives after the process of actually going through those lives. And if you accept what I'm saying, well, there's some interesting things that are worthwhile observing. First, we don't always know what our stories are. I'm feeling this stuff, but I don't yet know what the words are I want to add, attach, use to describe that experience. I don't always get it right. I start by saying one thing and then I say, no, 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 the meaning of the words I'm using to describe the experience don't seem to actually capture the essence of that experience. I need to change those words. My story is actually changing over time. Others have influence on our stories, particularly when we're young. When I was young, I was told this is what a good boy does. This is what life is all about. And I started to, and this is, you know, I started to shape the meaning of my life in words based on what others told me was happening to me. And then slowly as I got older, I was able to start to own, to define for myself what my experiences actually meant for me. But they're still shaped, influenced by other people. When I go to the doctor and the doctor tells me that this is what's going on for you, he's actually or she's actually helping me to make meaning of my story, but the way she or he frames it is actually going to guide the way I understand it myself. And I may decide that's actually the wrong understanding, that that's actually not the meaning that's going on in my life. One of the most important things about our stories is the power they contain to shape who we become, to influence the choices that we make. You might be wondering about these pictures on the screen. They remind me of a story, a funny story that I've become more fond of lately. It's about this koala bear who's in a forest and diligently climbs up this tree, goes to the highest branch, puts his arms out, and jumps off, and splat lands tragically on the forest floor. But jumps back up, climbs that tree again, goes to the branch, jumps off again, splat, falls again, and continues to repeat this cycle, which is heartbreaking to watch. These two birds are watching this with love and pain, and they're saying, one of them says to the other, honey, you know, we really need to tell him he's adopted. Because obviously the koala thinks he's a bird. And so of course I'm anthropomorphizing here, but the story is meant to point out that what we understand ourselves to be can guide what we actually do in our lives. So the stories we tell about our lives, psychologists will tell us, are really important to our sense of well-being, our happiness, our ability to cope with suffering. They kind of bring they're the way that we bring kind of a unity, an integration to our experiences, and how different experiences connect one to the other, and how who we are is kind of integrated, knitted together through the various experiences that we have. They help us with suffering because they help us understand why certain experiences are worthwhile going through and why others are not. And we should actually not do it. I know that I need to work hard every day because the pain that comes from working hard is not easy. It's working hard, but it's important because it gives us something. And that makes that working hard a worthwhile thing, an activity to participate in. So it helps us to deal with suffering. And so as we go through this, and as you think about the ideas I'm going to share, I invite you to ask yourself, what's your story? Why are you in healthcare, assuming that you are? What's the purpose of the pursuit that you're engaged in your life? What meaning does all of this have for you? If you've gone through experiences of pain, moral distress, we'll describe that a bit more in a moment, what's the meaning you're making of it? What's important to you in your life and why? And we'll pick these ideas up as we go. So let me shift now and talk about Sarah and Mr. Wilson. So Sarah's a nurse. She works in a community dialysis clinic, and she's been there for 2 years, so she's young, new to the profession. She lives at home with her sister and their mother. And this COVID experience has been interesting for her because on the one hand, it's been anxiety-provoking. There's lots of fear and uncertainty in the world, and that's true in her life as well. It's also, though, been giving her a sense of purpose, a sense of meaning. She sees the value of being a nurse for the community when it experiences this kind of calamity, the kind of calamity that all of us around the world are actually experiencing. It's also made providing healthcare very difficult in some ways. There's all of a sudden patients are no longer allowed to have their families around, and they play a really important role in their lives. She has to gear up all the time she's encountering patients, so she's constantly having the physical discomfort of PPE, and it's really complicating the caregiving experience. But also importantly, there have been changes to standards of practice that she grew up with, she studied with. So, for example, she, ordinarily when you would just intervene and provide attempt resuscitation if somebody went into to arrest. But in the new standards for providing attempted resuscitation, including donning personal protective equipment, making sure that you can only do certain interventions, and you cannot do some of the other more intensive kinds of interventions that would have been normal or that would have been considered standard of practice in a non-COVID context. And so one day, Mr. Wilson, who's been coming to the unit for the last 3 years, healthy, robust man, came to the unit, but has been compromised in terms of his health, in addition to the kidney function issues that he's dealing with. And he's been tested. He's showing all of the symptoms of COVID, but he's been tested, but we're waiting for the results. But he's been put on precautions, and the understanding on the unit is that we will transfer him to hospital if his COVID test comes back positive. Now, towards the end of Mr. Wilson's dialysis treatment, he starts becoming short of breath. There's tightness in his chest, and he feels extremely unwell. And within a minute, he all of a sudden is unresponsive. And Sarah suspects, obviously, that he's having a cardiac arrest. And normally, she would start CPR and chest compressions, but she can't. She can't, she's got to don certain kind of PPE before she intervenes, and she can only use a certain kind of manual intervention. She can't actually offer any kind of anything more intensive than that. Now, this is taking time. Getting the PPE on itself is taking time, and she sees Mr. Wilson increasingly cyanotic. He's turning blue. The ambulance has been called, but there's just standards of care do not allow her to do anything more. And she's in this situation where she's almost jumping out of her body, wanting to do more, but prevented, held back by this new standard. And she's torn. This is why she became a nurse, to act in the face of suffering. She's taught, I need to do whatever I can when patients are in distress, but she's got her hands tied in this COVID context. She's feeling suffocated, and she's overwhelmed by guilt. And she's in the throes of what we might describe as moral distress. And so how do we help Sarah? How can Sarah help herself to deal with this kind of situation? And that's what we're going to talk about in a minute. But before we do, I'd like to talk a little bit about what moral distress is, maybe, and tie it to this idea of integrity. So let me start by asking, how would you define integrity? We can't have a conversation. I'd love to have a conversation about this, but I'll cut to the chase and tell you what my perspective is. From my perspective, it's in a simple way, integrity is actually the alignment, the coherence, the integration of what matters in life and what happens in life. It's about understanding our talk and then walking our talk in daily life. It's the congruence of these different things. If you look at the series of photographs that I've got on this slide here, in my opinion, all of us, even now, are somewhere on this spectrum. The extent to which we understand what matters in life, and that's showing up in our lives, is the extent that we're on the right side of the spectrum. We're clear, we're whole. When this person shows up into a room, people know what to expect. They know what she stands for. They can almost predict how she's going to behave. When she looks in the mirror, she has a clear understanding of who is looking back at her. When it's the case that we don't know what life's about, what matters to us, or we're prevented from having that show up in our lives, either because we lack the courage to take the actions required to bring those about, or because external forces are preventing those things that matter to us from showing up in our lives, is the extent that we're on the left side of the spectrum. On the left side of the spectrum, if I showed you that picture, you might not even know what it was a picture of. The woman that's looking into the mirror at that picture doesn't know who's looking back at her. She shows up in a room, people don't necessarily know what they're going to get. There's an incongruence, an inconsistency, and the experience of it is almost a disintegration. And that brings me to the first point I want to make about moral distress is, well, it's not the first point. I have a terrible habit of wanting to number things, but I'm never in the right order. Anyway, what I want to point out, a really important point I want to make, is the alignment between our living with integrity and our emotional experience of life. Let me put it this way. Why does integrity matter? One of the reasons integrity matters is because it affects our state of well-being. When it's the case that what matters to us is clear to us and it's showing up in our lives, we're on the right side of the spectrum, we're usually feeling well. We're feeling whole. We're feeling connected. We might even be feeling happy, peaceful, joyful even. When it's the case that we don't know what matters to us, or what matters to us is not showing up in our lives, we feel we feel painful kinds of things. We feel disintegrated. Disintegrated feels like being in the throes of painful feelings like guilt, anxiety, helplessness, powerlessness, sadness, frustration, anger, these really painful kinds of things. We're feeling like we're pulled apart. We're no longer able to be whole. And so moral distress is the term that's often used to describe this idea of not being able to live up to what matters to us for a variety of reasons, and the painful experience that comes with that. So, so what I want to say then is, if you think about Sarah's story for a moment, why is she feeling pain? Well, I'm hypothesizing that the painful experiences come, we feel pain, when things that matter to us, we're either scared we're going to lose, or we believe we've already lost. I'm losing a part of myself. So why is Sarah feeling pain? Because it matters to her to serve her community. It matters to her never to abandon a patient, to save a life if I can save it. These things are important to her. They're core commitments to her identity. And she's not able to live them in the experience of serving Mr. Wilson. And as a result of that, she's feeling that deep pain. So what should Sarah do? What do we do with that? Well, I want to suggest that responding to moral distress involves a number of steps. There's a number of things that we can do. The first thing that we can do is actually start to articulate what's going on, the experience that we're having. Sarah hasn't done the thinking yet about why she's feeling that pain. She's in the grips of the pain, of the anxiety, the angst of not being able to do what she wants to do, what she thinks is important in life. And she needs, the suggestion is that she needs to help deal with this, to start putting those words to that experience. What is going on? How is she feeling? What's important to her? And we'll talk about this in just a moment. Then she needs to start to make meaning of the experience, and I'll talk about that in a moment as well. The fact of the matter is that moral distress describes an experience where we do end up losing things, or we may end up losing things that matter to us. And if it's the case that we've actually experienced something of loss that happens, a values loss, like loss of commitment, then that requires grieving, dealing with the emotional pain that comes from that. And so that's the next thing. And then after that, it's about saying, okay, well, now, how do I actually go into the world? How do I understand what the meaning of my life should be? I want it to be. And then how do I enter the world in a way that will allow me to conserve as much of that meaning of what's important as I can? And then to rebuild the relationships, or build relationships that are required to actually do that and move forward, and then to reintegrate kind of into life. So there's this experience of pain, pause, collecting ourselves, reintegrating, and then responding that we're recommending. And I'm just going to talk about a couple of these things for a moment. So the first thing, in terms of telling the story, articulating that experience, the recommendation is that Sarah would actually start to say, well, okay, what is it that I'm feeling? What are the words I would use to describe the emotional experience I'm having? The pain that's in my shoulders, that's in my heart, maybe that's in my body and my head. Is it guilt? Is it anger? Is it frustration? Is it sadness? What is going on? And what does that tell me about what's important to me? What am I worried I'm going to lose or I have lost in this situation? And what is it that I still actually have in the story, in my experience? And of the things that matter, what matters most and why? And then there's this other really important idea as well about, I've got this story about what matters to me, but what actually is going on in the world? What are the facts? Have I actually lost this or not? So let's dig into this a little bit. So go back to our picture for a moment. I suggested that the pain that Sarah was experiencing was in part because it mattered to her to save life, not to abandon her patients, to serve her community, things like that. And she was feeling like she wasn't able to live up to those things. But if you ask Sarah, what else matters to you, she'll say probably, well, the reason I didn't put on that, I didn't just dive in and actually give Mr. Wilson CPR is because I also want to be sure I minimize the spread of COVID-19. That I actually want to be around to save more people over time, serve more people over time. I want to keep the other healthcare providers that I work with safe. I want to stay true to my professional guidelines and my the standards of practice that are prescribed for me. I want to keep myself safe so I can keep my family safe. I want to live my life. And there are other things that also matter to Sarah. And so then we want to ask Sarah, okay, I'll come back to this. Okay, so then Sarah, when you're thinking about this stuff that matters, how would you prioritize this? What matters most to you and why? Is it the case that the things that you maybe still have, like protecting your family, protecting your colleagues, minimizing the spread of infection, does that justify the loss of the commitment to save life when you have the opportunity to? So it's the making meaning by prioritizing the things that life is about for Sarah and trying to figure out how she negotiates that. And part of the series of questions I posed earlier included, again, that question of fact. Because it's not just enough to understand what's important to us. We need to know what's reality actually like. Is the assumption I'm making actually matching with what's going on in the world? So for example, for each of the things on the left here, we want to interrogate, she wants to interrogate the facts. So if it's important for her that she doesn't abandon her patients, for example, or saves any life, then it's important to just to check in. Well, what could she have done for Mr. Wilson? And she probably could have done a lot more. But what would have been the consequence of that for him? What would the quality of life that he would have, and I'm not suggesting for a moment that that's not important. That's not the purpose here. The point is that in order to live that value, there's an assumption about what actually is going on in the world, and she needs to check that to make sure that her understanding of what she's losing or thinks she's lost is actually true. If she's interested in minimizing the spread of infection, well, then what are the facts here around minimizing the spread of infection? How does the infection spread? What role does PPE play? And was she effective in living up to this value by not intervening further in Mr. Wilson's arrest? If she wants to serve the community, she wants to know, she needs to be able to understand the facts. Which way am I serving the community better? What's the impact of my serving the community by intervening, by not intervening? What's that looking like? If I'm actually not intervening, then what does that do for my ability to serve the community in the long run, for example? These are facts that she needs to be able to interrogate. So these are the questions then that meaning making requires. What matters to you, Sarah? How do you prioritize these things? And I want to point out that these things that usually matter to us that I put around that circle there in that image, they're actually based on much deeper commitments that we have. Much deeper understandings about what the world is all about. I want to serve my community. I want to maintain standards of practice because I have an understanding of what it means to be a good healthcare provider. My understanding of what it means to be a good healthcare provider rests on my understanding of what being a good human being is actually all about what it means to be involved in healthcare, about what the purpose of life is. So I'll just pick up on one of these ideas very quickly to try to tease this apart. The reason community matters is because we have an understanding, a belief about the way human beings are connected to each other. What is that? Is it the case that you believe human beings are kind of disconnected and happen to bump into each other in the world? Is it the case that you believe human beings are actually deeply connected, maybe spiritually connected, part of a single spiritual entity? I don't know, I have my own views, but I'm not suggesting what you should believe, but I'm just observing that your understanding of what the nature of connection between human beings is going to inform how important it is for you to actually serve community in a certain way and to interact with other people, to look after the well-being of other people. And don't have time to go into it in more detail, but I just want to observe that there's a lot more going on than just the superficial understanding of what matters in the moment. Then we want to ask the question, okay, well, of the things that matter to me, what can I hang on to? And what am I going to have to sacrifice? And actually, I'll go back to this. So if I'm having to sacrifice things, if it's the case that Sarah says, you know what, it really is important for me to look after the community's well-being, minimize the infection spread, maximize the protection for healthcare providers and myself and my family, and that justifies the cost of not intervening for Mr. Wilson, that doesn't undermine the value of the commitment to supporting Mr. Wilson. So Sarah's got to recognize that that losing a deep commitment hurts. And you need to be able to grieve that. You need to respect yourself to be able to manage and say, okay, well, how do I process that pain? How do I acknowledge the importance of what I've lost, that this pain is meaningful, and then go through it, breathe through it, move through it, such that I can actually continue to work in the world. So she has to ask the question, does the reality that I'm in, does it give me enough of what matters to me to continue to justify leaving behind what I feel like I have to leave behind, or not? In which case I need to change my reality and act differently than I have been in the past. And she'll have to make those kinds of choices. And then she has to ask, okay, well, what do I do with this? What do I need to tell myself? How do I need to understand this? And what do I need to tell others and build in my partnerships with others? Okay, so we've talked about telling the story and making meaning, and I've already spoken a little bit about grieving and planning and rebuilding. In the interest of time, I just want to jump to this idea of building resilience, because the things I've been talking about that Sarah would need to do in the moment, they don't just automatically occur. I would actually argue that building capacity to deal with moral distress, having that resiliency, is actually or requires a set of skills. Living with integrity requires skills. It requires skills of critical thinking, of emotional intelligence. It requires time and experience. It requires conversation and relationships. It requires trust and respect. And then it requires access to tools. And I don't have time to go through all of these things, but I'm going to quickly go through a number of them in just a moment. So very quickly, just wanted to reconfirm in a way the critical thinking, that building capacity to deal with moral distress requires the ability to really identify what my story is, what's important to me, to prioritize, and then to justify that prioritization. I need to be able to understand what the facts in the world are, as we've talked about. It requires the ability to understand our feelings, to recognize what's going on in our hearts and in our bodies, to give names to these feelings, to link these feelings to our understanding of what matters in life, and to process these feelings. Very important emotional intelligence. I might come back to this a little bit later. I think what I want to point to here is, well, let me talk about this, links to that, and I think I might soon close with this. The question I want to ask is, if integrity is about walking your talk, how do you arrive at what your talk is? And I want to argue that there are three ways. There's inspiration. Sometimes you kind of just get a clarity that comes from somewhere. There's monological reasoning, kind of thinking, go for a walk and try to figure things out for yourself. What matters to me in my life? But I want to suggest the most important and reliable way of figuring out what our talk is actually being in conversation with other people. It's by testing our language out, our ideas out with other people, that we actually get a deeper understanding of what matters to us in our lives. Now, the other really important thing that matters is both how we develop our talk and also how we work with others to negotiate our lives. See, we don't go through life alone. We experience life in partnership with others. And well, the question I would ask you is, how do you figure out your talk? If integrity is walking your talk, how do you figure that out? There's multiple ways. We can sort of go for a walk, that's what I do, and try to figure things out, or we might be hit with inspiration if we're fortunate. It doesn't happen very often, for some of us anyway. But I want to suggest that actually the way we figure out our talk and the way we go through life is actually in partnership with other people. It's by giving voice to our experiences, our perspectives, in conversation with other people that we start to reflect on our views and get a deeper understanding of what really matters. And the story I want to tell, and I'm going to come back to this slide to close with, is the story about, well, to illustrate actually the importance of conversation. So like a good healthcare provider, about 15 years ago, I started to say, okay, you know what, I should have an advanced care plan. So what I did was I went for a long walk and I realized, oh my goodness, I love my work. So that's really what drives me in my life. And so I said, okay, if it's, I came to my wife and I said, honey, you know what? If it's the case that I can no longer think, I can no longer have the kind of conversations I have with people, I can't do the work that I love to do so much. I love to solve hard problems with people. If I can't do that anymore, I have nice ideas about what happens when I die. It's all good. You can feel free not to intervene. You don't need to treat me. You don't need to, you know, whatever. And she looked at me after I said that and she said, well, that's selfish. I thought, oh no. And she said, well, I knew I was in trouble. This always happens. This is my learning constantly. And she said, well, you know what? You might not be able to think your highfalutin thoughts, your big ideas and your fancy hard work that you're so proud of, but your son and I might be able to care for you. Your son and I might still be able to love you, even though you're in you have less capacity than you do right now. And when she said that, I was kind of blown away for a moment. I was like, oh my goodness, you're absolutely right. I love my work, but the most important thing in my life is my family, the well-being of my son and my wife. And if it's the case that they're well, and I have these ideas that life afterwards is all good, then so I said to her, you can do whatever you want then. Actually, you choose. It doesn't matter to me what happens afterward. Now, I don't want to get into the content of my choices, but the point is, I figured out what matters in my life because of that exchange I had with my wife. And what I'm saying is, for us to really understand this, and for us to actually negotiate what's going on in our lives with others, we need to be able to work with others in an effective kind of way. And this is captured in this idea of pluralism. So here's what I want to say to close this off. For us to be able to talk to other people, to help make meaning of our lives, as we're humbly, fallibly trying to figure out who we are, we need to create trusting, respectful environments where when we tell others, this is what I'm trying to figure out, what do you think? They can come back to you and say, interesting. Let me reflect back to you what you're saying. This is what I think. Let's build this solution out together. If I'd gone to my wife and she simply shut the door and said, I don't care what you think, I'll just do whatever I want. Or if Sarah goes to her manager and says, I'm feeling terribly and I'm trying to make sense of why. And the manager said, just shut up and do your work, Sarah. We don't have time for any of this nonsense. Sarah's not going to be willing to have that conversation. She's simply going to have to hunker down and try to deal with this and cope with this situation by herself. And that will deprive both of them of the opportunity of understanding what's really going on in that experience. And having that kind of constructive, productive, relational experience to help make meaning of our lives requires being able to treat each other in certain kinds of ways. And I call that respectful engagement. I don't have time to get into it. I have a very specific definition of that I don't have time to unpack right now, but that's what it requires. And that's what I want to urge us to think about. So I think I'm just going to stop on this slide. Thank you very much for being with me for this presentation. And I look forward to the conversation that's going to follow.
Thank you, Bashir. That was amazing. Very thought-provoking, as I knew it would be. I do want to start off with one question. You mentioned in your talk a trusting and respectful environment when speaking to someone in your workplace. Can you maybe give us some tips on how to start the conversation with someone if you perhaps believe that they are suffering from moral distress or distress of some sort? Could you give us some tips maybe to support each other?
Absolutely, happy to try. So the first thing that comes to my mind is that I think that emotions is a great place to start because we often know what we're feeling. So if we see a colleague hurting, it's appropriate, I think, and useful to ask, how are you? You look like you're having a hard time. What's going on for you? And then the words they use to describe their experience, you can use as jumping off points to probe a little bit deeper. Well, what are you worried about? What is it that's important to you that you feel like you're losing? That kind of thing. But how you process this and the environment of this really does matter. So the space you're asking, when you ask, and how you respond to listen as opposed to tell them your story will have a huge impact on this. And this is sort of, it'll also depend on the broader context, the relational context that you've created for having these kinds of conversations. Did that help, Sarah?
Oh, it did. Thank you. That was great. I think that really helps. It's hard to start a conversation. I know we're all healthcare professionals and we're caring people, but sometimes, we forget to take care of each other. And I think it's really important as a group. So thank you for that. Do you find that we, oh, there's one question here about sharing our slides. Yes, we will be sharing the slides on the BC Kidney Day website. So that will be on there. Thank you for that question. And sorry, I've lost my train of thought now. Do you feel that anxiety and moral distress is higher now as we're moving into second wave, or people kind of know what to expect, or maybe it's too soon to tell? What are your thoughts on that?
Yeah, I think that my observation is that there is an underlying anxiety that I think most of us are feeling. That's just my rough observation of people in the healthcare context as well as just in society, because there's so much that we don't know. And what's happened is that there are parts of life that we used to take for granted that really are important. Our ability to socially connect with each other, so important. And yet now we can't do that. And we're trying to figure out, okay, how much of this is justified? What's more important? Protecting myself and protecting the broader society from having this infection spread and having greater sickness in society, or protecting our broader understanding of what makes life worth living and doing the daily stuff of living with people and being with people and laughing with people and loving people in a very, close way. And we're having to kind of weigh these things. And I don't think it's clear yet what should matter most to many of us. So we're in that anxious, curious, confused space where we don't know. And we're getting very clear direction from one end, and our hearts are telling us something different.
Yeah.
And we have to try to figure that out.
Absolutely. Thank you. One more question. Are you able to share any resources or articles to responding to moral distress and making meaning or reflecting on it? Is there a place that maybe you could direct us as a starting point, knowing that our talk this morning was all about some of the myths and whatnot? So it would be great to have a resource that you could direct us to, or
Yeah,
suggestion?
absolutely. I mean, maybe what we do is afterwards we can just provide. So this is there's been a lot of writing on moral distress. So the literature on moral distress, it exists. It's a rich literature that includes both conceptual ideas for making sense of it, as well as how we might respond. So if it makes sense, I think that might be an easier way to do it, is just to point to some resources in something that's available afterward.
Wonderful. That's great. Thanks. So I see our time is up, sadly. We could probably talk about this all afternoon, but I want to thank you, Bashir, for your enlightening presentation. And thank you, everyone, for watching and participating. Lunch is up next, actually, and there will be a cooking demo at 11:35 with a live webcast if you want to join in. So thank you. And yeah, just thank you. I mean, I'm overwhelmed with emotion. So thank you very much. Bashir.
Thank you so much for having me. I really appreciate it. Thanks for the conversation, Sarah.
Bye, everyone.
Bye-bye.